childhood is a time of innocence and joy. Unfortunately, there is a growing, unrecognized menace that robs children, adolescents and their families of this special moment in their lives. Pediatric malignancies refer to cancer in a child or a young adult, which age ranges between 0 to 19 years old.
Childhood cancer incidence is increasing. Every year, more than 300,000 children and adolescents below 20 are diagnosed with cancer. Many more remain undiagnosed, unrecorded and unreported. Childhood cancer is curable. However, every year, more than 100,000 do not survive. 80% of these children, adolescents are from low and middle income countries where health systems are weak, health services are often inaccessible and unaffordable, essential medicines are not available or too expensive. Even high-income countries are faced with the escalating burden of childhood cancer as it is now infectious diseases.
Unlike many adult malignancies, where environmental toxins have been shown to be etiologically important, most childhood malignancies appear to be associated with consistent chromosome abnormalities, which place the child at increased risk for specific malignancies.
However, a few environmental factors, such as radiation exposure, have been linked with some types of childhood cancers. Some studies have also suggested that some parental exposures, such as smoking, might increase a child's risk of certain cancers.
Fortunately, many childhood malignancies exhibit considerable sensitivity to available agents. Cure rates of childhood cancer have thus improved, and with this improvement, radiation oncologist is now participating in potentially curative treatment strategies. So, now we will tell you about some common pediatric malignancies.
Neuroblastoma. Today we are going to see the introduction at first. Neuroblastoma is a solid cancerous tumor which begins in nerve cells outside the brain. It's common in infants and young children whom is below than 5 years old. Often starts at adrenal glands near spine in the neck, chest, abdomen and pelvis. Etiology. Mostly an inherited disease. Time taken to develop cancer is between 9 to 13 months earlier than usual. Also caused by genetic changes with a variation in germline without family history. How to detect neuroblastoma? The detection method is lump or mass in the abdomen, eyes bulge out, dark circles, pain in chest, pain in arms, legs and bones, and unable to walk. And also fever and anemia with low red blood cells and constant diarrhea. Diagnosis methods. Biopsy, blood test and urine test, bone marrow aspiration and biopsy, CT scan, and also MRI scan, PET CT scan, MIBG scan. Staging of neuroblastoma. There are two types of staging of neuroblastoma, which is INSS and INRGSS. Tumor attached to the lymph node, tumor located only at the site of origin, and no nearby lymph node is affected by cancer equal to 2B. Tumor located at the site of origin 2B, 3 is metastasized to the regional lymph node, and number 4 is original tumor metastasized to distant. 4S, original tumor only located at its origin. The treatment method for neuroblastoma: surgery, chemotherapy, radiotherapy, and stem cell transplantation. Other than that, we have also got retinal therapy and immunotherapy. Prognosis. Prognosis depends on age, stage, and biology. 5 years of survival rate is lower than 1 year is 90%, and 10 to 14 years is 66%. The stage is low risk neuroblastoma is more than 95, and higher risk neuroblastoma is from 40 to 50%. Epidemiology of neuroblastoma. 70% children per year is diagnosed with neuroblastoma in the United States. 6% of among all the pediatric cancers. Often found in children younger than 5 years old, and it is the third most common type of cancer in the world. It's rare in children who are more than 10 years old. Power is gained by sharing the knowledge, not by hoarding it. Let's share the knowledge.
Rhabdomyosarcoma is a type of soft tissue sarcoma that begins in mesenchymal cells, which are immature cells that normally become muscle. Usually begins in muscles that are attached to bones that help the body move. About 350 children are diagnosed with rhabdomyosarcoma each year. More than half of children are diagnosed in those under age of 10. 5-year survival rate for children younger than 14 is 70%. However, it depends on the tumor location, risk group, and stage. Common sites of RMS are head and neck, urinary and reproductive organs, arms and legs. Ways to detect rhabdomyosarcoma are by lumbar puncture, bone scan, MRI, bone marrow aspiration, and biopsy. To stage RMS, it depends on 3 key factors that are type of RMS, whether it is alveolar RMS or embryonal RMS, TNM staging, the clinical group. The treatment are by chemotherapy, radiation therapy, high-dose chemotherapy, surgery. The prognosis are type of RMS, patient's age, size of the tumor, where in the body the tumor started, whether the tumor had spread to other parts of the body, whether the tumor responds to chemotherapy or radiation therapy.
Jason is playing computer games in the living room. Suddenly, he shouted for pain in his right leg. His parents are worried about him. He was suffering from high fever, and he has a loss of appetite, which results in loss of weight. So, his mother decided to bring him to see a doctor. The doctor instructs for some examination, such as X-ray. X-ray will probably be the first test done. A bone tumor can usually be spotted on an X-ray. MRI scan, which is done to get a better look on an abnormal area seen on an X-ray to determine whether it is a tumor or an infection. It can also help to determine the extent of tumor. CT scan, to see if a Ewing tumor has spread to the lungs. Bone scan, to see if the cancer has metastasized to bone in other part of body. PET scan, which can show the spread of Ewing tumors. And lastly, biopsy of tumor and bone marrow aspiration and biopsy. So, here is the MRI image, CT image, head image, bone scan image, X-ray image, and the result of tumor biopsy.
Hi doctor, what happened to my son?
He is diagnosed with Ewing sarcoma, which is the most common bone cancer in children. It occurs most frequently on the skull, chest wall, pelvis, long bone of legs or arms, and spine. This disease most often occurs in adolescents, and it is more common in female than female. Epidemiology. Ewing sarcoma occurs in approximately 1 in every 50,000 teenagers, with a peak incidence at age 15. It accounts for 30% of all bone cancer that occurs in children. The frequency of Ewing sarcoma in the population younger than 20-year-old is approximately 2.9 per million.
Doctors, what is the cause of Ewing sarcoma?
The exact cause of Ewing sarcoma is unclear. It isn't inherited, but it can be related to non-inherited changes in specific genes that happen during a person's lifetime. Exchange of genetic material between chromosome 11 and 12 is usually observed in patients with Ewing sarcoma.
As the cancer spread beyond the main side, what is the stage of the cancer and what does that mean?
It's stage 2A and the tumor is localized. The formal staging system for Ewing tumor is the American Joint Committee on Cancer System for Bone Cancer, AJCC. There are 4 key pieces of information in AJCC system. T describes the size of primary tumor and whether it appears in different areas of the bone. N describes the extent of spread to regional lymph node. M indicates whether the cancer has metastasized to other organs in the body. G stands for the grade of the tumor. It is important to know that all Ewing tumors are classified as G4, high grade, so they are never stage 1 bone cancer.
What does tumor is localized mean?
A localized Ewing tumor is thought to be confined to the area where it started.
How about metastatic Ewing tumor?
A metastatic Ewing tumor has clearly spread from where it started to distant parts of the body. Most of the time, it spreads to the lung or to the bones or bone marrow.
How much is the chances of being cured or how long he can expect to live?
With current treatment, the overall 5-year survival rate for patients with Ewing tumor that are localized when they are first found is around 70%. However, when the cancer is already spread when it is diagnosed, the 5-year survival rate is about 15 to 30%.
What are our treatment options? What do you recommend?
The treatment options are radiotherapy, chemotherapy, and surgery. In fact, almost all children treated for Ewing sarcoma are treated with a combination of chemotherapy and surgery or radiation because chemotherapy is often the first course of treatment for Ewing sarcoma. Unlike other cancers where surgery might be the first step, doctors use chemotherapy to reduce the size of tumor before removing it surgically. It is also used after surgery to eradicate any remaining cancer cells. After chemotherapy has reduced the cancer, surgery is likely to be more effective for treating Ewing sarcoma. At this point, most of the time, surgeon will remove the tumor if possible. In some cases, children will need graft of bone or tissue or artificial bone to replace diseased area that must be removed. Very rarely, amputation is required to fully remove a tumor. Radiation can also be used in combination with chemotherapy and surgery to kill cancer cells that surgery cannot remove. It will be used instead of before surgery in tumors that cannot be removed or after surgery as chemotherapy does.
10 months later.
Congratulations, he has survived cancer!
Yay!